Now, the World Health Organization has said that the unavailable vaccine doses last year sort of created the perfect breeding ground for the emergence of virus variants. Sort of explain to us that science of the unvaccinated and the mutating virus.
Yeah, yes, based on what the WHO that the journalist said is that it has been found that among those people that were not vaccinated, what made the virus to actually mutate is when there is ongoing transmission. So, based on that fact, among those people that are not vaccinated, and which we have a very large proportion of them, there is that possibility that the virus will mutate. And that is why he was talking about the fact that we will not see the end of this pandemic in terms of the kind of variant that will still emerge. That Omicron is not the last time we make, or as long as there is ongoing transmission among citizens. And yeah, looking at the coverage, you'll find that not only Nigeria alone, it gave statistics that out of 194 member countries, only about 92 were able to meet the target of 10% in September last year and 40% as of December. It went as far as even saying that about 36% are yet to meet the 40%. And so, meaning that as long as there is ongoing transmission of this virus, especially among those people that are not been vaccinated, there is that possibility that the virus will mutate and a new variant may eventually emerge. And that was why he made mention of the fact that we are targeting 2020 this year, that by December this year, we should be able to achieve at least 70% coverage in all the 194 member countries. And that is why we may be talking about the issue of herd immunity, because without herd immunity, the transmission will go on. And unfortunately, those people that are not vaccinated, if you look at it very well, are those people that are relatively being affected in terms of severity and the rate of hospitalization. Thank you.
Dr. Ganiu, still, with all of this, I mean, yes, WHO DG has said that, but do you actually see the world sharing out vaccine doses, and this is more fairly to end the death and destruction of COVID-19?
Yes, certainly without that, because even made mention of the fact that no matter the period of giving booster doses for those that have had their complete vaccine, that may not actually solve the current challenge as regards to the ongoing transmission. So the way forward is to ensure vaccine equity, ensuring that every country have access to this vaccine, so that they can have appreciable number of people that are vaccinated. And if you look at it very well, the issue of vaccine inequity has been a major challenge. And one thing you have to understand is that we cannot solve the issue of this COVID-19 in isolation. Even if a country should achieve 70%, as long as people continue to move in and move out of that country, it may dilute such coverage, and which may also make people susceptible to getting infected. So the most important thing, based on what WHO says, that the country must move at the same pace and towards ensuring that everybody is covered and protected so as to prevent further transmission. As long as there is continued transmission of this virus, there is bound to be more mutations and likely of another variant, emerging in the nearest future.
So countries like Austria, for example, is limiting the validity of vaccine certificates to about 6 months, which would mean perhaps further boosters there. In Nigeria, hesitancy to vaccines is still rife. Some are even suggesting making it a prerequisite to getting a driver's license to present your vaccination certificate. What do you think?
Well, I think looking at the idea of issue of human behavior, because when you want to look at the issue of acceptance, uptake of vaccine, you have to consider many factors. The human factor. I would like to talk about that's what we call the dilution of innovation theory, which means that usually when there is a new thing, a new innovation, that usually the early adopters, those people, they don't need to be persuaded. You see them coming in, and we'll be able to see much of that when the vaccine was first initially introduced into the country. Subsequently, we now have those people that have that hesitancy. They don't want to, they are still a bit reluctant, not being convinced, and so on. So these are the people we need to talk to. Then we now have those people that are completely resistant, they don't want. And what we have further complicated this has to do with the fact that the issue of misinformation. Maybe some people made some careless comments at the beginning that the vaccine can lead to important, can reduce life expectancy and so on. Then when I have disinformation, which is what the anti-vax are doing, a kind of creating a negative narrative as regards to that vaccine. So all these issues, coupled with the fact that we have some local factors, for instance, the issue of trust. I remember during the early stage when they were sharing palliative and so on, things were not done appropriately, and at the end of the day, you can see what led to that. People have lost trust. People are more concerned about the issue of accountability, a lot of misconceptions here and there. So in dealing with this, usually I said the aspect of presenting is one of the aspects actually to actually create demand. A kind of, you present your certificate first, which is part of an intervention and request to address the issue of human behavior. Apart from presenting your certificate, you can also deny some people from accessing certain areas if you are not vaccinated, which is, all these are based on best practices. Maybe people going to the market, if you don't present your certificate, you cannot go into mass gathering where there are people, a lot of people will convert there. Apart from this, motivation can be that those are aspects of actually incentive for award, but we can go higher by kind of trying to introduce pluses. It could be a token, It may not be money, because I've said it earlier, in form of food or whatever, which we've done before when we are trying to kind of eradicate polio virus in the country. It can also help. Another point we can suggestion is we can have COVID-19 vaccine champions, ambassadors in our communities, and there will be like opinion leaders in the community, influencers. It could be partners. They will be trained on some of these basic aspects of what they need to do in their community, and through that process, they can also help in a kind of creating demand. Will be another aspect of what we are doing, risk communication, trying to enlighten people, let them see the importance of this vaccine in terms of efficacy, safety, and effectiveness.
Quite a number of factors.
Thing we can do. So we need to actually put some of these things in place. Through that process, we can be able to develop some good strategies on how we can actually create demand, create uptake in terms of making people get
vaccinated.
Accepted to this vaccine.
Thank you so much. I also know that a number of people would prefer the incentive part, but we appreciate your time, your expertise on this issue. Dr. Jamiu Ganiu is a public health physician. Many thanks for joining us.
Thank you very much. Thank you.
Well, still to come on the program, a report from Taraba State, plus new recommendations to curb the Omicron variant in Germany. We have that and more. Please stay with us.